united here. Everybody wants the motto of my office, we want to be pro-family, pro-worker, pro-patient. I think each of you could say that. Now, the question is, how do we get there? And we want that person, our fellow American, to retire with adequate benefits. As an aside, by the way, Ms. Friedman, I agree with you regarding social. And one thing that we've ignored so far is that in 8 years, there'll be a 20% cut by law in social benefits. Senator Kaine and I have a bipartisan bill that would attempt to address that, even increasing benefits for those at the lower income scale. That's not this committee, but I just want to mention that because Social Security getting a cut of 20% would be anti-worker, anti-patient, anti-family. So that said, now I'm going to speak to the two of you, please. Senator Sanders pointed out some things we should be concerned about. Increasing wage inequality, disparity. And his prescription is, as we heard. But in California, both of you referenced how AB 5, ostensibly that was going to improve things for workers, ended up with lower employment overall, not just among independent workers, but if I read your testimony correctly, Ms. Cavan, among union workers too. Yeah, so why don't you start, Ms. Cavan, real quickly, because I only have limited time, and just speak to what seemed to be, oh, we're addressing this, and probably California has the greatest disparity between CEOs and workers. We ended up with workers being worse off.
That's right. The union data that I cited came from the U.S. Bureau of Labor Statistics, and if you look at the chart, you can see the line going straight down. Talking about what I said in my opening statement about I went freelance because I thought I could earn more money, accurate. That turned out to be true for me, and it turns out to be true for a lot of people. One of the most recent studies that just came out on that was Upwork. They looked at the skilled freelancers who are performing knowledge work. We brought in about $1.5 trillion in 2024, and more than a quarter of us in the United States are freelance. Those who earn exclusively through freelance work report a median income of $85,000, surpassing their full-time employee counterparts at $80,000.
Include the benefit of, Mr. Driscoll would probably ask, does that include the benefit of benefits? If you say 20% of your income goes towards benefits, is that 85K accounting in that differential, accounting for the fact that the person who's full-time employed has benefits as well?
Well, we have to pay for we don't get access to those good, juicy group rate plans. That's what you're trying to fix, and Senator Paul is trying to fix for us. I actually brought my health insurance stub, my monthly pay stub that I have to shell out to get silver level, not even gold, Blue Cross plan in New Jersey. $999.87 a month just to get access to the health care. That's supposed to be affordable healthcare? No, it's not. And I took a little poll.
Is that doing an exchange?
We have to buy independent individual plans. And I took a poll among independent contractors that I know. Some of them are getting jacked for $2,000 a month. If they have kids, $3,000 a month. Premiums. These are premiums. This isn't even going to the doctor and getting something done. And yeah, a lot of us do well as freelancers, and yeah, we have to pay more for the health insurance because the rules have to be changed.
How would you comment upon this?
I mean, to the point that in California, the fact that the original bill had to exempt over 100 different occupations because it was so sweeping. And then even after that, you have 600 occupations full of tens of thousands of Californians who are still under the gun of AB 5, and they have lost incomes, they've lost contracts, they've lost livelihoods, they've lost small businesses. I've spoken to a woman who had a breast cancer survivor. She was raising 3 children while starting a business, and AB 5 in 2019, it really helped to push her out of business. So when you talk about mass reclassification, which is what this effort really is, it's a sweeping effort to try to consider every single independent contractor and every occupation as the same. And sure, there may be misclassification in some industries, but it's concentrated in some industries, and you're penalizing a lot of people who do not want to be penalized.
So, Mr. Coleman, Ms. Cavan spoke about those premiums being so high, but the association health plan, by pooling risk, how do you estimate that would lower the potential premium, health insurance premium for such a worker? And be quick, please.
It would open it, lower it potentially by thousands over an annualized period, depending on factors of location, age, et cetera.
Well, it would lower it by thousands depending upon those factors, but within each location, theoretically, it would lower it, correct?
Right, right. I was just making accounts for, differences in the local cost of healthcare.
I'd like to ask you two, but I'm out of time, and I'll defer now to Senator Sanders.